day everyone, my name is Sharon Lejero from Reason 1B, and for this video, I will demonstrate to you the specimen collection. Its definition is, a specimen is a sample of material taken from the patient's body to use diagnosis and laboratory examination. And also, a specimen collection means collecting a specimen. There are 7 types of specimen collection, which is the clean catch, midstream collection, and 24-hour urine specimen collection, urine specimen collection from an infant, and catheterized urine specimen collection, and stool specimen collection, sputum specimen collection, and the last one is throat swab culture. Midstream clean catch urine collection. So its definition is, midstream clean catch urine collection is the most common method of obtaining urine specimens from adults, particularly men. This method allows a specimen which is not contaminated from external sources to be obtained without catheterization. It is important to follow the clean catch protocol in order to have an accurate results from an uncontaminated sample. And its purpose is, the clean catch urine method is used to prevent germs from the penis or the vagina from getting into the urine sample. It is also a method of collecting a urine sample for various tests, including urinalysis, cytology, and the urine culture. And this is valuable for confirming alterations in metabolisms and infections and fluid volume problems, and to determine appropriate antibiotic to administer to a specific patient. And we have also the equipment and the material. So the first one is container with warm water, and the second one is the soap, the washcloth, and antiseptic swab or cotton balls, then the sterile specimen container, and the label for the container, and the bedpan, and also the last one is non-sterile gloves.
Identify the client, check to see if permission is required. Explain the procedure to the client, provide for privacy, wear clean gloves, position client and place. Perineal area with proper technique, ask client to begin voiding. When stream of urine begins, put the specimen container, obtain 30 ml of urine for routine. Analysis, 5 to 10 ml for culture and sensitivity or CNS. Remove container before client starts avoiding. Allow client to complete avoiding, then wash perineal area.
Hi, Miss Lejero. I am your student nurse today, and am I going to taking care and I am here to cover this specimen to identify why you have a problem in your urine. Okay, ma'am?
Label specimen completely and accurately. Clean bedpan, use discard gloves, wash hands, and send specimen with appropriate laboratory.
Perform is the 24-hour urine specimen collection. So its definition is, a 24-hour urine collection is performed by collecting a person's urine in a special container over a 24-hour period. It always begins with an empty bladder so that the urine collected is not left over. From previous hours, the specimen shows the total amount of waste the kidneys are eliminating and the amount of each. And its purpose is, a 24-hour urine collection is non-invasive. The skin is not pierced. It is used to assess kidney or renal function and detects diseases, and to provide the means to measure the concentration and the dilution of urine. So there are the materials and equipment. So we have the urine specimen container, or enough to collect 1.5 liter, and refrigerator, label for specimen, sign that urine collection is in progress.
Identify the client and explain the purpose, procedure, give instructions to clients which are up around. Place sign in client's bathroom stating that 24-hour urine collection is in progress with date and time.
The next procedure we need to perform is the urine specimen collection from an infant. So its definition is pediatric urine specimen is collected from infants who are incapable of telling the time of urination and the following direction for collection by themselves. So its purpose is to collect pediatric specimen accurately, and the materials and equipments are the cleansing, swab or cotton balls, towel, pediatric urine collection, and the diaper.
Identify client, explain the procedure to client's mother, cleanse and dry child's perineum, apply urine collector to the child by placing child's penis through the opening collector or male, squeezing the opening of the collection bag over the child's urinary meatus, avoiding extension over anus, place a clean diaper on the child, wash your hands and check the collector every 15 to 20 minutes, remove collector if already filled with urine and place with a clean diaper on the child. Pour urine to the specimen container, send it to the laboratory, and also don't forget to wash your hands. For the evaluation, evaluate urine specimen obtained, evaluate laboratory, requisition if filled out completely, documentation, record method used to obtain specimen, record amount, color of the other specimen, record of time the specimen was sent to the lab and received by the lab technician.
The next procedure that we need to perform is the catheterized urine specimen collection. So the definition of this is collection of urine specimen from the catheter. So the purpose of this is to obtain sterile urine specimen for microbiological analysis, and the materials and equipment is a sterile 10 ml syringe with 23 or 25 gauge needle, then non-sterile gloves, then alcohol swab, a sterile specimen container, and a container labels, catheter clamp,
Identify the patient, explain the purpose of the procedure, and provide privacy. Clamp about 4 inches below junction of drainage, tubing a catheter. Leave a clamp for 10 to 45 minutes. Wear a gloves. Clean specimen collection part of drainage tubing with alcohol swab. If no collection part is visible, cleans catheter tubing close to the junction of drainage in tubing. Carefully insert sterile needle of syringe into the collection port of self-sealing catheter at 45-degree angle. Aspirate the required quantity of urine specimen. Slowly squirt urine in the specimen container without touching inside of container. Send specimen laboratory promptly with proper label and proper requisition. Discard gloves and washing hands. Evaluation: appearance of the urine in bag and specimen obtained. Also evaluate condition of urinary catheter. The documentation: record procedure of flow, sheet, record method used to obtain specimen, record appearance of urine, record time specimen was sent to the lab and received by the lab technician.
So the next procedure we need to do is the stool specimen collection. So the definition of this is stool is a waste materials eliminated from the bowel, and a stool culture is the process of growing or culturing organisms in feces to see if any of them cause disease. The common is the ova and the parasite test, a microscopic examination of the feces for detecting parasites such as amoebias or worms. Stool specimen is often tested of blood, Wallach or Pneumococcal. This may be done in the laboratory but are sometimes done at the nursing station to test stools for occult blood. So the purpose of this is to determine the elimination status of the client, to identify the GIT function. So the equipment and materials of this is wide mouth bottle or disposable wax box, and tongue depressor, clean bead pan, bedside commode, tissue paper, washcloth, soap and water, and sterile test tube, and sterile cotton applicator, and or for stool and sand is and container label and clean gloves.
Identify the client and explain the purpose of the procedure. Wear gloves. If the client is able to go to bathroom, give him or her needed instructions. Provide privacy and place client in mid or high folders position. Place bedpan. Ask client to void first, clean out urine from bedpan. Put back the bedpan. Instruct the client to defecate, raise side rails, place the hall light within reach, and leave the client if it is safe to do so. Remove bedpan from the defecation and cover it. Help the client in cleaning premium. perineum. Take the covered bedpan to convert to room. Obtain a small portion of fecal material. Place it carefully in the specimen container. Clean bedpan, remove gloves and hand wash. Clean bedpan, remove gloves and hand wash. Send the specimen to the laboratory immediately. Documentation. Record the following: time the specimen was collected, sent to laboratory, description of the stool and condition of the perineal skin.
The next procedure we need to do is the sputum specimen collection. So the definition is sputum is a dead cough film collected by the laboratory analysis. And its purpose is a sputum specimen is obtained for culture to identify the microorganism responsible for lung infections and identify the cancer cells shed by lung tumors, and aid the diagnosis and management of occupational lung diseases. The materials and equipment of this is the sterile sputum specimen container with cover label for the specimen, emesis basin, tissue paper, small plastic bag for delivery of the specimen to laboratory, glass of water, face mask.